Chances are you know someone affected by breast cancer.
It's the most common type of cancer worldwide, and in 2024 in the U.S. alone, doctors will diagnose an estimated 310,000 women with invasive breast cancer. When it comes to battling the disease, patients undergo intense treatments, often with painful side effects.
Reporter Heather Graff shows us how new technology and a little TLC can go a long way supporting people during their diagnosis and beyond.
Michelle Apple has always loved lifting weights, but the biggest test of her strength was a breast cancer diagnosis.
You go through anger, you go through denial, you go through, oh, I'm going to fight this, I'm going to beat this, and then you have your bad and good days.
Michelle says doctors misdiagnosed her when she found a lump under her armpit. But after her mother died from breast cancer, she returned to the doctor.
I ended up finding out that I was stage 3. I had 23 lymph nodes cancerous, mastectomy, had my ovaries removed, and then in addition to that, I had, months of radiation and chemo.
Michelle is one of an estimated 4 million women in the U.S. living with or beyond invasive breast cancer. It's the second deadliest cancer among women, which has doctors developing high-tech solutions like a wearable ultrasound.
It's a device that is connected to a bra that a patient can wear, and then there's an ultrasound transducer that's connected to the bra.
Developed by MIT, the tech allows the wearer to take ultrasound images of their breast in the comfort of their own home.
And then they can take another picture the next day or the next week, and then the software will compare the pictures.
Breast cancer surgeon Dr. John Bumberry says the device is for women who have a high risk of developing cancer.
And they're getting close follow-up as it is. And close follow-up usually means we see them every 6 months or so.
And his hospital is home to another treatment showing early promise, this time for its ability to treat the painful side effects of radiation.
Can you imagine being sunburnt for 5 weeks and then having it get worse for a week or two after the radiation's done, and it's still not completely resolved until about 4 to 6 weeks after the radiation?
Mercy Hospital in Springfield, Missouri is part of clinical trials treating radiation burns with a bandage called Mepitel. Typically used as a wound dressing, doctors say Mepitel is showing encouraging results among patients getting radiation.
So far, none of my patients who've gotten the Mepitel have had any skin breakdown.
Including Lynn Lee, who saw positive effects of her own.
They asked if I'd be interested. I said, absolutely. I mean, if it would potentially help any radiation effects, why not? And if being in the clinical trial would benefit other women, there's no downside. And plus, it doesn't hurt.
Back at the gym,
Keep up the good work.
Michelle is now treating people battling breast cancer in a different way. In 2019, she started the Apple Warrior Breast Cancer Foundation.
We help pay for travel expenses and also medical bills that aren't covered through, obviously, insurance. And what we do is, as long as the funding is there, we help where we can help.
Her ultimate mission,
Don't let it define you. Push forward.
is to give her fellow breast cancer survivors hope to carry on.
Have your bad days, but understand you need to pick yourself out, brush yourself off, and that next day know that it's a new day. Don't let it define you, but let it inspire you to help others.
Doctors at Mercy Hospital say Mepitel is being tested in a clinical trial so it can be available to more patients. The goal to get it FDA approved to treat breast cancer radiation so insurance will cover the bandage. As for the wearable ultrasound, we're told it's undergoing clinical trials and is expected to be available in 4 to 5 years.
The fight to end breast cancer doesn't stop there. Researchers have spent decades working on a vaccine that can treat the disease and even prevent it. They say the results during clinical trials were promising.
Now is the time for cancer vaccines.
We reveal how the vaccine works and introduce you to one of the first patients to try it.
Did you have any hesitation in getting the vaccine as part of the trial?
None. I was waiting for the time.
Watch the full story on investigatetv.com. Just search breast cancer vaccine.